you're a Discovery Health Scheme client, expect no increase in membership fees for the first 6 months of next year. Contributions will only be hiked from the 1st of July next year. Discovery says it sees that the hike in July to be about at 5.9%, and that's an average of just under 3% for all members over the year. Ryan Noach, who's the CEO of Discovery Health, joins me now to discuss this and more. Ryan, many thanks for your time this evening. I must say, I've got a big smile on my face as a client of Discovery Medical Aid, but I'm very interested to know, other medical aids announced their increases last week, and you've decided to put a freeze on yours. What's motivated that decision?
Thanks very much for having me. It's not arbitrary at all. It's an actuarially sound and rational increase. Every year, the scheme increases for Discovery Health Medical Scheme are calculated based on medical inflation for the period. Typically, medical inflation runs at a premium above consumer price inflation of about 3 to 4%. We've projected medical inflation in the period January to July next year as being zero, largely because of the change in utilization patterns of healthcare services through COVID. And so we've matched the contribution increase to the medical inflation, consistent with all other periods, and given the members of the benefit of this complete contribution freeze.
Right. Is there a sense of how many people have had to let go of their medical aids in the period, when people are not able to afford many things? Sometimes medical aid or car insurance are usually the first things to go.
Very interesting that you ask this. In fact, we've seen the opposite during this period. Since the lockdown began in March this year, Discovery Health Medical Scheme has seen about a 50% reduction in the lapse rate. The lapse rate is the number of people who are choosing to withdraw their policies from the medical scheme, and that's reduced by about half. The main reason for that seems to be that through a global healthcare pandemic, consumers do realize the importance of having robust and good medical scheme cover, medical insurance, to make sure that in case of need, they have the right financial indemnity and access to brilliant healthcare. And so actually it's the opposite of what you report at this stage. That said, we recognize that the economic hardship that the country is going through, not only as a result of COVID and the lockdown, but also starting in the pre-COVID period, may well result in lapses, and we're watching this very carefully.
Right. Very interesting insights there when it comes to lapses. And then right now, I just want to get a sense from you. Is Discovery Health looking at new product offerings that will be perhaps a little cheaper than the ones that you currently have on offer as we get used to the new normal and really just the affordability rate of South Africans?
Within the medical scheme market in South Africa, there is quite tight legislation through the Medical Schemes Act, which restricts the minimum entry price for medical schemes in South Africa. This relates to provisions called prescribed minimum benefits, which is a set of almost 300 conditions which medical schemes have to fund in full at cost at all times. This means that the entry price of medical scheme cover in South Africa is raised to above 900 Rand per individual per month by virtue of the legislation. It's not possible for a medical scheme to provide a fully funded product that complies with the legislation below that price. There are other insurance-type products available in the market for employer groups, but these are not medical scheme products, explicitly so, and do not confer the same benefits as medical schemes to clients. An example of that is Discovery Primary Care, which is a product we sell on the Discovery Life license to employer groups in South Africa, and that's priced at around the 300 Rand per employee per month mark, but only available to employer groups. Discovery Health Medical Scheme does have the largest low-income medical scheme option in the market. That's the Key Care plan. It has about 250,000 members on the plan and provides a brilliant, fully covered service for the lower income of formerly employed earners, mostly in South Africa.
Right, now this new rate that you'll be increasing by next year, is it a once-off COVID move, or can your clients expect it to be in this range in 2022?
The expectation of clients should always be linked to medical inflation. medical inflation determines how much the cost of healthcare increases year on year. And typically, medical inflation all around the world runs above consumer price inflation. In South Africa, it's somewhere between 3 to 6%, unfortunately, above consumer price inflation. So if CPI is at 3%, in a typical utilization period, medical inflation could be somewhere between 6 to 9%. The reason for this premium is because of the consumption of healthcare, which is quite different to many other industries. There's not only price factors that affect this, but there are consumption factors which affect it. And so contribution increases will always be linked to medical inflation in order for any medical scheme to be able to keep up with the cost of delivering healthcare.